Hello, I'm Dr. Jeff Rodzak, one of the obstetrician gynecologists who will be assisting with your care during your pregnancy. I'd like to first offer our department's congratulations on your pregnancy. Having a baby is certainly one of the most wonderful, exciting, and joyful experiences in your life, and it is our hope that we can help make it as memorable and as safe as possible. As you're probably aware, delivery by cesarean section has become more common over the last several years for a number of various reasons. But the old saying, once a C-section, always a C-section, no longer is true. Many women who have had a baby by cesarean section could deliver their next child vaginally if they so choose. But no procedure, whether vaginal delivery after cesarean section or planned repeat cesarean section, is without risk. What I'd like to do today is to provide you with some information on the risks and benefits of both of these options, which may assist you in making a choice on how you would like to deliver your baby. The American College of Obstetricians and Gynecologists, or ACOG for short, have recommended that the following conditions be met before women are allowed to undergo a vaginal birth after cesarean section or VBAC attempt. Number 1 previous cesarean section performed with a low transverse or side-to-side incision on the uterus itself. It's important to realize that the incision on your abdominal skin is not as important. That incision may be either side-to-side or up and down. Again, it's the incision on the uterus that is the most important in determining whether you are an acceptable candidate for a VBAC attempt. Number 2 previous low transverse cesarean sections with a previous vaginal delivery. If you've had 2 previous cesarean sections with low transverse uterine incisions and a previous vaginal delivery, you may also have the option of choosing a VBAC attempt. Number 3, no other uterine scars. If you have had a previous surgical procedure on your uterus which involved making a uterine incision, such as a myomectomy or removal of a uterine fibroid, you may not be an acceptable candidate for a VBAC attempt. Likewise, if you have experienced a uterine rupture with a prior pregnancy, VBAC is not recommended. In addition to these conditions, ACOG also recommends that certain conditions need to be met by hospitals that offer VBAC attempts. These conditions include, number 1, a physician capable of performing an immediate cesarean section available throughout active labor. Number 2, immediate availability of both anesthesia and operating room personnel in case emergent cesarean section is necessary. I'm quite pleased to tell you that Gundersen Lutheran Hospital does satisfy both of these requirements, and we are proud to be able to potentially offer you the option of a VBAC attempt. There are a number of benefits to attempting a vaginal delivery after cesarean section. Among them include a quicker recovery time from delivery, avoidance of major surgery, a shorter hospital stay, and decreased surgical and anesthesia risks. However, there are some risks involved with a VBAC attempt as well. These include uterine rupture. The biggest concern that we have is uterine rupture during labor. This refers to a tearing of the uterus itself, which will usually occur along the scar line of the previous uterine incision. The risk of uterine rupture is quite low, less than 1%, but when it does occur, it can be life-threatening to both mother and baby. Number 2, extensive surgery and possible hysterectomy. Should uterine rupture occur or be suspected, an emergency cesarean section would need to be performed. Extensive surgical procedures may be required to repair the uterus, and hysterectomy or removal of the uterus may be necessary. Number 3, blood transfusion. Blood transfusions are often needed to help stabilize the mother's condition as well. This is the reason that both the Department of Obstetrics and Gynecology here at Gundersen Lutheran and ACOG recommend that VBAC attempts occur only in hospitals that have the capability of performing immediate and emergent cesarean sections. But even under these strict guidelines and recommendations, not all injuries or deaths to mothers and babies can be prevented. As we discussed at the start of this presentation, there are some factors that may increase the risk of uterine rupture or tearing in labor. These include, number 1, 2 or more cesarean sections with no prior vaginal delivery. Number 2, an up and down uterine incision on the uterus. Number 3, attempting to induce labor with certain prostaglandin medications such as Cytotec. Number 4, a short or less than 24-month interval between deliveries. Please be assured that both IV and epidural anesthesia are reasonable and safe pain control options during VBAC attempts, which can be used as needed and when appropriate. Of course, there are also risks that accompany elective repeat transverse cesarean section. What are the risks of repeat cesarean section? Compared to a successful vaginal birth after cesarean section, repeat cesarean section is associated with an increased risk of the following complications to the mother. These include a longer hospital stay, more blood loss, more frequent need for blood transfusions, increased risk of infection, increased risk of blood clot formation in the legs or lungs. Some long-term complications include placenta previa or placenta accreta. The more cesarean sections one has, the greater the risk of developing problems with placenta previa, a condition in which the placenta grows over and covers the cervix, which is the opening of the uterus. This condition may lead to significant vaginal bleeding problems throughout the pregnancy. The risk of placenta accreta, a condition in which the placenta grows into the muscle of the uterus, is also increased. This condition may result in the inability to separate the placenta from the uterus after delivery of the baby, possibly resulting in hemorrhage and possible need for removal of the uterus. Both these conditions can be very dangerous to both you and your baby. For those choosing VBAC, the overall chance of delivering vaginally is approximately 70%. But there are some factors that may improve or decrease your chances of delivering vaginally. Factors which may improve your chances include a previous vaginal delivery, a previous successful VBAC, prior cesarean section due to breech presentation or non-reassuring fetal heart rate. Factors which may decrease your chances of vaginal delivery include cesarean section after reaching complete dilatation, less than 24 months between your deliveries, induction or augmentation of labor, an estimated baby weight of more than 9 pounds, pregnancy past your due date, and the mother being significantly overweight. Despite these factors, it is important to note that many women who fall into the decreased chance of successful VBAC category do go on to deliver vaginally. Ultimately, the decision on how to deliver your baby is yours. The OBGYN staff at Gundersen Lutheran believe that either option, VBAC or elective repeat cesarean section, is reasonable. I encourage you to discuss any questions or concerns regarding this decision with your care provider, and certainly hope that you will utilize their expertise and knowledge to assist you in making this most important decision. Finally, your nurse counselor will be giving you a short form to complete once you have viewed this video presentation. Your signature on this form will indicate that you viewed the presentation and did have the opportunity to discuss any questions or concerns with the nurse. You will see this form again on at least 2 other occasions. Once in the course of your prenatal care, at which time you will be asked to select your method of delivery, and again at the time that you present to labor and delivery to have your baby. Please be assured that this form is not meant to be a binding contract, but rather an instrument to help us make sure that you have all the information that you need to make an informed decision on how you would like to deliver your baby. You do have the option of changing your mind or plan for delivery at any time during your pregnancy. We hope that you have found this video presentation informative and helpful. By no means do we expect that it will take the place of face-to-face conversation with your provider, and we do encourage you to address any questions or concerns that you have with your doctor or midwife. I wish you all the best with your pregnancy and am confident that you will make the best decision for both you and your baby.